Oh, hey guys. Welcome back. This week, Mill Spill episode. We're talking about if you've got an issue, check your tissue. And this week I'm going to be talking about busting the myth that everyone is treated the same. Now, you may have been in therapy before, or been in clinics before, or been treated health wise, and you're doing the same thing over and over and over again. I know this because my father, family members have told me about the therapy experience that they've had, and we are better than that kind of treatment. And I think a lot of that comes from a misunderstanding of what the tissue is that we're treating. So behind me, I have a board, and I'll take you through the different tissues that we commonly treat and see, and also take you through a little more in depth of what we do for those tissues. So I want you guys to have a good understanding of what and how to break down the different tissues, and understand that in doing that we also have a lot of misunderstanding about what the best practice is for the treatment of that tissue and how to identify it. And that is really the main goal and objective of me, for me as a therapist, is to be able to identify that tissue. And if your therapist or healthcare provider cannot identify it, then you have to ask questions as a patient as to whether or not you're getting the right treatment. If you're getting the same thing over and over again, you walk in, you can do most of it at home, then we're not changing, we're not identifying, we're not adapting, we're just doing what we have seen and not learning about how to treat specific tissues. So here we go. If you look behind me, you can see on this board here, we have a lot of different tissues, okay? Typically, we have cartilage, bone, muscle, tendon, ligament, and last but not least, and always forgotten, nerve tissue. Okay, so identifying each one of these is a task in itself, but a trained therapist should be able to identify which tissue is at fault. So a lot of times cartilage, if we start there with that breakdown, you can see here we have the knee joint, a great depiction of that with the picture that I've drawn. And the cartilage tissue is that structure that sits on top of the bone to protect it. So this tissue can get broken down, worn and torn with repeated movements, increased stress, poor movements, okay? And there's been some nice research out there on kind of regeneration of cartilage. How do we do it? Do we use stem cells, things like that? And the truth of the matter is that you can. It takes a lot of time though. So when you replace or grow cartilage to be replaced, and a lot of times it's an alternative to knee joint surgery, a lot of times you have to take your time with it. It's very unloaded tasks for about 6 months. And that's so that cartilage tissue can kind of create a callus over the injured area of cartilage that's already there. So when it performs that callus, and then when you load it, it stays. A lot of times if treatments advance too much, that cartilage packet that they put in with the stem cells to regenerate, if you load it or stress it too much and don't give it the proper amount of time to heal, it will rip off, and it will be a waste of thousands and thousands of dollars to protect your name. So the treatment for cartilage tissue is much different. Now, if we go into bone, that's the simplest, right? If we take apart the recent action of a Dallas Cowboys quarterback, Dak Prescott, he fractured his tibia and fibula, okay? And compound fracture, meaning breaking through the skin. Now, bone, if it was just that bone, 4 to 6 weeks, healed up, doing great. Bone is one of the fastest healing tissues because it has a lot of blood supply. But he also encountered a dislocation. And that's when we talk about other structures, which we'll get to, okay? But bone is the easiest to heal. You just got to wait, let it heal, let it do its thing, casting, whatever is needed is appropriate. Next, we go into the muscular tissue. My amazing picture you can see here This is actually the quad muscle. Coming down as three different muscles into that you can see attaching to this tendon to your kneecap and down. Okay, so muscle tissue, that is one that it's one that we deal with most in physical therapy, or the past we've learned about the most is how to treat the muscle. How do you identify the muscle? A lot of times we get that through our manual muscle testing. So a therapist may take you into the evaluation room and test, oh, how strong is your bicep? Is it shaking? Yep, you can see that. And we determine how strong you are. Well, there's different ways to assess what the status of that tissue is. If you're testing the muscle appropriately, okay, so being sure, we can't just say, I've seen this. We can't just say you have a rotator cuff tear. One, because we can't diagnose that as a physical therapist, so they can't tell you if you have one. What I can tell you is if you have a lesion in that rotator cuff, and I do that with specifically testing the muscles, and that's how you identify and specify what muscle is being targeted with exercise. And then there's a proper progression of how you train that muscle or treat that muscle, depending on what we think is going on. Now, the gold standard for any muscle is an MRI to know if there's a true tear and that. So I'm not saying that we can identify that, but we can say if the muscle has injury and then the best way to treat it. So, and again, finding the therapist that can do that is important. If we scroll down, now we get into ligaments. So this ligament picture shows the knee as well, and I've depicted the ACL and the PCL here in the picture. Great artistry, as I know, but those are major ligaments of the knee. And this is the one you hear athletes tear and rupture all the time and have replacements with, whether it's from their hamstring or their other tendon that gets replaced in that area. And that rehab is actually one of the easier ones to do. A tendon or a ligament of that structure is pretty easy. Now, identifying and that's a full tear. But there are different stages of ligaments tearing, and your therapist should be able to identify what stage you are in and then how to protect it. Because if there's one thing we know, ligaments do not regenerate. So they don't have that ability. They don't have that blood supply. You have what you have, and the only way to get it back is if you have surgical intervention. So, and using of a different tissue, because we don't regenerate ligamentous tissue. So something else to dive into when we're treating specific tissues is protecting what you have if it's not fully torn. And that's again a different style of treatment. And lastly, but not least, my favorite is treatment of the nerve. How to properly identify nerve treatment. This is a great depiction of a spider web of nerves here that I have drawn for y'all. And nerves are my favorite because they can act like almost any other tissue in the body. They can make you feel like your muscles are tight, your muscles are sore, you have swelling, you have numbness, tingling, hot, cold. They can replicate all of those symptoms. So differentiating between a nerve and a muscle and a nerve and a tendon and a nerve and a ligament and a nerve and a joint is fun for me. It's like a puzzle. And I find a lot of the times that patients who don't get fully better are not better 100% of the way because we have forgotten about the nerve structures. Nerves are like a spider web of tissue that can be affected in many different ways and can yield many different symptoms. I believe this is why therapists get trained to kind of chase the pain around. But if they actually identified that it was the nerve and where that nerve was being problematic, they'd be able to solve the issue and find that missing piece to that puzzle. So these are the tissues that I most commonly see and treat. And I know I went through the identification of what they look like or what they do, but it's your job to invest in yourself as a patient. If you're having symptoms in these areas and you're not sure of what the actual tissue is, and you haven't been told, this is exactly what I'm treating, this is what I think is wrong with you, you need to ask that question, or find a therapist who you do believe can address that. All of my background is in fellowship training, and I've gotten the most experience and the most out of that because the education is way more in depth, and it allows you to be able to accurately and efficiently identify and treat the different tissues that you have, and how to do that. So take care of yourselves. I always ask the question, what tissue's involved? How can I improve it? How can I treat it? And when will I get better? So again, if you've got an issue, check your tissue, y'all. Take care. See you next time. Bye.